In this video, we're going to cover drug absorption. We're going to break down what drug absorption is, the factors influencing this process, and the different routes of administration. Let's start this lecture by first answering what exactly is drug absorption and why is this important. If you've seen the previous lecture on the introduction to pharmacokinetics, we went through an overview of the 4 important processes. And you've seen this overview diagram, this big picture that we're going to zoom into and break down. Let's simplify this. So the first process is absorption, which is the movement of a drug from its site of administration into the bloodstream, making it available for distribution to various tissues and organs. Imagine for a moment that drugs are like cars, each with a unique destination within our bodies. Just as cars need to navigate roads and highways to reach their intended destination, drugs must navigate the pathways of absorption to reach their target sites within the body. And understanding how drugs enter the body is important for understanding how drugs work, their effects, and even potential interactions. The key factors that influence drug absorption include the physiochemical properties of the drug, the route of administration, GI factors, drug formulation, and blood flow to the absorption site. So now let's subtract complexity and go through these factors in more detail, starting with the drug's characteristics. This is important because these properties are what determine how a drug will move around our bodies and how drugs work in our system. Okay, starting with the lipid solubility of the drug. This is important in determining how well a drug can pass through cell membranes. The presence of cell membranes act as a protective barrier for the body. Unless given intravenously, a drug must cross cell membranes before it reaches the systemic circulation and reach their intended target tissues. So remember, cell membranes are primarily composed of a lipid bilayer, which has a hydrophilic heads and hydrophobic water-repelling tails. The lipid bilayer's selective permeability allows it to control the passage of substances into and out of the cell. So small non-polar molecules can easily pass through cell membranes, so epithelial membranes, while larger or charged molecules may require specific transport mechanisms. Okay, so lipophilic means lipid-loving. These are molecules that have an affinity for lipids or fats. They love lipids, okay? On the other hand, hydrophilic means water-loving. These are molecules that have an affinity for water and may rely, again, on specific transporters to assist in their passage. So lipid-soluble drugs are better absorbed than water-soluble drugs and have a better ability to cross the lipid barriers in the body, increasing their likelihood of absorption into cells and tissues, okay? So you can see how a drug's characteristic will influence how it's transported. The next characteristic is the size and shape of a drug molecule. Smaller molecules will be better absorbed than larger molecules, and that's because smaller molecules will easily cross cell membranes, allowing for rapid absorption into the tissues and the bloodstream. Large molecules have difficulty diffusing through cellular barriers. These macromolecules often rely, again, on specialized transport mechanisms or undergo endocytosis and exocytosis processes to cross cellular membranes, which we'll go through later on in the lecture. Another factor is the ionization state, which refers to whether a molecule exists in a charged or uncharged form, okay? Why is this important? Why are we talking about this? Because this significantly influences its solubility and permeability, which are important factors in absorption. So there are different pH values in the body, okay? So the stomach can be quite acidic, the pH of blood or plasma is quite neutral, and the pH of urine can be basic. Let's break this down. So some drugs are more or less lipid soluble as a function of pH. This is because they have different sites of ionization. So the ionization state of a drug is strongly influenced by the pH of its surrounding environment. Some drugs can be charged or uncharged depending on the pH. Now here's the thing. Drugs can be classified as acidic, basic, or neutral based on their tendency to donate or accept proton, hydrogen ions. Most drugs are weak acids or weak bases, which mean they can be charged, ionized, or uncharged, unionized, depending on the pH and the pKa. What's important for pharmacokinetics is that the uncharged form has a better ability to cross cell membranes, resulting in improved absorption and distribution. Let's draw this out. Here we have an uncharged drug molecule that can cross lipid membranes. So this means that when the drug is in the blood vessels or blood capillaries, it will be easier for this molecule to cross the barrier into the tissues. So as a result, it's going to be better absorbed and distributed compared to charged molecules. On the other hand, a charged molecule can be positively charged or negatively charged, And as a general rule, we're going to say that charged molecules hardly cross through lipid membranes. So they're going to be less distributed and less absorbed. An easier way to explain this is imagine a drug playing hide and seek with cell membranes, If it's charged, ionized, it's like waving a flag, It's easier to spot because it's waving either a positive sign or a negative sign. So the lipid bilayer can see it. If it's not charged, it's incognito, so it can easily cross through lipid membranes, cell membranes. So the ionization state influences how well a drug can slip through cell membranes, impacting its absorption journey. So remember, if it's charged, it's waving a positive or negative flag, and if it's uncharged, it's incognito, It's in private. Let's go through an example of a weak acid and base. An example of a weak acid is aspirin. And aspirin can exist in two forms depending on the pH. The protonated carboxylic acid, Q, or the charged carboxylic acid. So it can exist under the charged A- form or the uncharged form AH, so it's protonated. This form here, again, is the protonated form, which is neutral. So it doesn't have a charge, it's in incognito. This form, AH, will have a better capacity to cross the cell membrane. And what does that mean? That means it has a better capacity to be absorbed and distributed. And the charged form hardly crosses through. Why? Because it's waving a negative flag, If we look at this in a simpler way, we have the charged form of a weak acid here, and the uncharged form can cross the lipid membranes, the incognito form, That's aspirin. Let's take another example, which is morphine. Morphine is a weak base, Again, it can exist in an uncharged form or a protonated form, pH+, depending on the pH. The uncharged form of morphine has a better capacity to cross lipid membranes, which means it can be absorbed and distributed more effectively. If we look at this in a simpler way, we have the charged form of a weak base, and the uncharged form can cross the lipid membrane. So the charged form is waving a positive flag here, so it's not going to cross, whereas the uncharged form is an incognito, so it can cross the membrane. Now there is a chemistry equation to relate the pH, the pKa, and the ratio of both forms, both for a weak acid and a weak base. This equation, and you may have heard of this equation, is called the Henderson-Hasselbalch equation. And we're going to apply this equation to calculate if a drug is more or less absorbed and distributed in different body compartments, So it helps us understand how weak acids like aspirin behave in different pH environments. The equation is expressed for acidic drugs and for basic drugs. Here, pH represents the acidity of the environment, pKa is the drug's acid dissociation constant, and A- and AH are the concentrations of the ionized and unionized forms for acidic drugs, and B and BH plus are the concentrations of the ionized and unionized forms for basic drugs. So we can apply this equation to calculate if a drug is more or less absorbed and distributed in different body compartments. All right, so that's the ionization state. The next drug property is the formulation. The form of the drug affects how quickly it is dissolved and absorbed. So we have solid dosage forms. Tablets and capsules are the most common and need to dissolve in the stomach or intestines before absorption. The formulation can affect the rate of dissolution. So some drugs have special coatings to control this process. There's also modified release formulations, which are designed to release drug over an extended period. Slow release formulations will provide a slower absorption. There's also liquids. They are often absorbed more rapidly than solids because they don't need to disintegrate. This is suitable for patients with difficulty swallowing solid forms, but food or other GI tract factors can have an impact on them. Okay, so the formulation will influence the kinetics of absorption. Now that we've talked about the basic properties of drugs, the next thing we're going to break down is the different routes of administration and how it influences absorption, because the path a drug takes into our body significantly affects its absorption rate. Okay, imagine it like choosing between different entry points into the city. Each route has its own characteristics impacting the speed and efficiency of drug absorption. We're first going to go through the enteral routes. The first one, which is the most common route of administration, is the oral route. So this is commonly referred to as PO. It's the most common because it provides a safe, least invasive, and convenient method of drug delivery. However, with convenience comes variability. Okay, so the absorption of drugs through the gastrointestinal tract can be affected by factors such as stomach pH, food presence, and individual differences. But in relation to what we talked about earlier, lipophilicity plays a role in oral absorption. Drugs that, like water, hydrophilic drugs, might have problems and need special ways or formulations to help them be absorbed better. Let's expand on the GI factors, because most drugs are absorbed in the small intestine rather than in the stomach. This is because there is a larger surface area in the small intestine that the drug can cross and get into the bloodstream. Another factor is the presence of food in the GI tract, which can delay the absorption or even in some cases can help. This is why in some drug it specifically says to have it with or without food. There's also gastric emptying. Okay, delaying gastric emptying can also slow the absorption. So people with problems with gastric emptying, well, that may affect the absorption because it determines how quickly a drug moves from the stomach to the small intestine. What else? We also have GIT motility, which refers to the peristaltic activity of the intestine. The intestines move and contract, okay? But if there are issues with this movement, it can be caused by diseases or drugs such as opioids, which slow down intestinal activity, okay? So it can have an effect on absorption. Another factor to consider is the pH level in the stomach. So depending on the stage of digestion, the pH in the stomach can be highly acidic, which can impact the stability and absorption of certain drugs. And there's also the presence of digestive enzymes, okay? We also have the ability to break down some drugs, okay? This is why certain drugs can't be administered in tablet form and must be given through alternative routes, such as injections. So then another important parameter to consider is the formulation, which we briefly mentioned earlier. The process of releasing a drug from its formulation, whether it's tablet, capsule, or suspension, is called liberation. The formulation affects how quickly the drug dissolves in the GIT. So the formulation will influence the kinetics of absorption. There are also some formulations that are modified to delay absorption. For example, enteric-coated tablets have multiple layers and dissolve in the intestine instead of the stomach, protecting the drug until it reaches the desired site. Let's draw this out. Let's consider we give a tablet of a certain drug and go through the different stages that the tablet will go through before the drug is absorbed. So first, the tablet will go through the disintegration phase, breaking down into granules and then into smaller particles. Next, the drug will be dissolved in the fluids of the intestine. And finally, there will be absorption through the walls, primarily in the intestine. Okay? And if you remember from the previous lecture, we introduced first pass metabolism, which is metabolism of a drug before it reaches the systemic circulation, before it reaches the bloodstream. And it mainly involves liver enzymes. First pass metabolism occurs for the oral administration route. Okay? The next route is the rectal route, the other end. Okay? This route of administration can be used for both local and systemic effects. But the thing is, there are several disadvantages associated with rectal administration, including potential irritation and issues with patient comfort. It's also important to note that 50% of the drug administered through this route undergoes first pass metabolism, meaning that 50% of the drug is metabolized by the liver before entering the bloodstream, while the other 50% enters the bloodstream directly. Okay? The last enteral route we'll look at is the sublingual, which involves placing the medication under the tongue without swallowing, or the buccal route, which is placing the medication between the cheek and gums. An example of this is glycerol trinitrate, which is an anti-angina drug that is highly lipid soluble. What does this mean? It means it will have a high capacity to cross physical barriers. Remember, sublingual absorption will avoid first pass metabolism and will directly get into the bloodstream. Okay, sounds good. Let's move on to the parenteral routes. This administration avoids the GIT. It will avoid first pass metabolism. What's first pass metabolism again? It's when a drug is metabolized before it reaches the systemic circulation. Before it jumps in the pool of blood, it's first metabolized. Okay, let's draw this out. The most common route is the IV injection, which refers to the placement of the medication directly into a vein. Okay, so we're injecting medications into the blood, eliminating the need for first pass metabolism. With intramuscular medications, these are injected in different body muscles, such as the deltoid. Okay, then we have subcutaneous. This is injecting a needle under the dermis, which the medication will then move into the capillaries and into the bloodstream. So the advantages of using the parenteral route include the ability to rapidly inject medication directly into the circulatory system, and of course, delivering a precise dose. Okay, this is why the IV injection is the fastest method, as it puts the drug directly into the bloodstream, ensuring immediate absorption. Okay, and this is why IV bioavailability is always considered 100%. What's bioavailability again? Bioavailability is the fraction of the administered drug that reaches the bloodstream unchanged. It's a measure of how effectively a drug is absorbed and available for action. Okay, and we always compare this fraction to what occurs with an intravenous bolus injection, where the entire dose is given directly into the bloodstream. Drugs absorbed through intramuscular or subcutaneous injections are absorbed faster than the drugs administered orally. Okay, now in the last lecture we explored the differences between taking medication by mouth, oral route, and through injections into the bloodstream, intravenous. Now, when we compared giving the same dose of ibuprofen through IV or oral routes, we observed that the IV administration led to quicker therapeutic effects due to faster absorption. However, as we can see here, the elimination speed remained the same regardless of how the drug was administered. We also covered how IV administration carried a higher risk of side effects because it led to higher drug concentrations in the bloodstream. Okay, and then if we were to change the minimum effective concentration, it could render oral administration ineffective. But we can see here IV administration would still provide the desired therapeutic effect. Okay, all right, let's take a look at another route of administration. For instance, let's look at inhalation, okay, through the lungs. The lungs have a large surface area, okay, and a rich capillary network consisting of small blood vessels. This means that the lungs promote the absorption of drugs and their direct entry into the bloodstream. Now, remember that when a drug is administered via inhalation, it's absorbed through the lungs, okay? So bypassing first-pass metabolism. So this allows the drug to directly enter the bloodstream. It can be used to achieve either a systemic effect affecting the whole body or a local effect, specifically targeting the lungs. For example, the inhalation of salbutamol, a beta-2 agonist, causes bronchodilation and is used to treat acute asthma. Okay, so that's inhalation. There's also the topical route, which involves applying the drug to physical surface, okay, such as the skin or mucous membranes, for example, eye drops. This route is typically used to achieve a local effect, such as on the skin or in the eye. It's important to note that this route also avoids first-pass metabolism. And some drugs can also be administered topically to provide a systemic effect. For example, patches can be applied on the skin to allow the drug to pass through and directly enter the bloodstream. Examples of this include estrogen patches for hormone therapy, fentanyl patches for pain relief, or glycerol trinitrate patches for angina treatment. So now that we've explored the various pathways drugs take through different administration routes, let's now shift our focus to what happens inside the body. We're moving from the how of entry to the what and where of absorption mechanisms. So starting with passive diffusion. Passive diffusion is one of the main ways that molecules get through biological barriers to reach the systemic circulation. This is the most common mechanism, especially for drug absorption in the GI tract. So here we're focusing on a drug passing through the cell membrane of the GIT and through the basolateral membrane to enter the bloodstream. Passive diffusion relies on the movement of molecules from an area of higher concentration to an area of lower concentration. It also depends on the molecule's properties, so relating it back to what we talked about at the start of the lecture, the molecule's lipid solubility, size, and degree of ionization. Remember that lipophilic or fat-loving substances and small molecules can dissolve in the lipid bilayer, allowing them to move across the membrane without doing anything. And remember when we talked about how most drugs are weak acids and bases existing in unionized and ionized forms, with the general rule being that the uncharged form has a better ability to cross cell membranes. Okay, incognito form. Okay, so that's passive diffusion. Next, we have facilitated diffusion. So with the help of certain transport proteins, molecules can move across a membrane in a process called facilitated diffusion. There are two main types of membrane proteins in facilitated diffusion. We have channel proteins and carrier proteins. This also relies on the concentration gradient. The carrier proteins, also known as transporters, assist in the movement of large polar or charged molecules that may face difficulties diffusing through the bilayer, okay? And then on the flip side, we have active transport, which is a process that requires energy, usually ATP, to move molecules against their concentration gradient, okay? So we're moving from an area of lower concentration to an area of higher concentration. That's active transport. Then we also have endocytosis, which can sometimes take in big or complex molecules, okay? The cell membrane engulfs, creating a vesicle that is taken inside the cell. Later, this vesicle may join with other parts of the cell or go through exocytosis to let the molecule get into the bloodstream. Once the drug has successfully crossed the plasma membrane of the cells, at the administration site, the drug can get into the systemic blood. Okay? So depending on the drug's properties, it may circulate throughout the body, reaching its target tissues and exerting its therapeutic effects. So that's drug absorption. In the next lecture, we'll talk about the next phase, which is distribution. Thank you for watching this video. Make sure you subscribe to EKG Science so you don't miss a single lecture. And remember, subtract complexity and slow down. To study the next lecture, simply click the next video, or you can view the entire playlist.